When I'm evaluating a patient for treatment, non-surgical injectable treatment of the face, I try to vertically integrate the different kinds of fillers, which we can inject at different levels to give volume to the face, to fill lines, to create more structure to the fat and bone of the face. And we can combine these with neuromodulators such as Botox and Dysport in order to bring the face together and restore its natural, soft, more youthful attractiveness of the face. Today we're going to talk about Sculptra, and we're going to be injecting a patient who's a 62-year-old woman, and she has a lot of loss of volume in her face. She's always had a very thin face. Sculptra is a very good product to use in a patient that has loss of volume. It's also useful in patients who have more volume but focal areas of loss of volume. But in somebody like a runner who has lost a lot of body fat, it's very useful. Somebody who's built with a very narrow, thin face. We can even change somebody who is born with a negative vector, a flatness to the projection of the cheek, or who has a very narrow upper face, and restore a more attractive balance to the face. Sculptra is going to last at least several years. It's FDA approved for a 2-year duration, but in my experience of injecting for 8 or 9 years, Sculptra, once you've achieved the correction that you want with several sessions of treatment, and achieve the volume correction that you want, it's very easy to maintain. You don't have to start over the next year like you do with some of the other fillers like the hyaluronic acids. After we're done injecting the Sculptra, because the Sculptra is delivered by injecting sterile water with the little particle in order to distribute it, we're going to see the water effect right away. So the patient really gets to see what they're going to look like because of that pretend water effect in the face for several days. So they tend to like the way that they look for the first several days. Unfortunately, that water effect gets absorbed in several days, and that goes down, and then it looks like we've done nothing, which nothing has occurred yet because the collagen stimulation hasn't begun yet. And that's going to take about 2 months to start to see that effect. It's like watching your hair grow. It's not going to happen overnight. It's going to happen very gradually, which for a lot of people is very nice because it gives a very natural, gradual onset so that other people aren't going to notice it in a dramatic way like fat transfer. It doesn't require overcorrection. It can happen very gradually and naturally. Once we've injected the Sculptra in a particular session, we're going to see the result, the full result from that session in about 4 to 6 months. And if we superimpose another treatment, say in 3 months or 4 months following the first treatment, then we'll see the effect from both treatments start to kick in. So we'll get our final result about 6 months from the final treatment. Sculptra is vertically integrated and used with other types of fillers and Botox, lights, lasers to improve the skin quality and texture. So the two really nice things to combine would be full face CO2 laser resurfacing, which would stimulate collagen in the skin, and Sculptra, which stimulates collagen deep. So we're getting an overall picture with both of those treatments, and both of them are stimulating the patient's own collagen, which results in a very nice, natural, healthy appearance and reversal of some of the aging changes. After we inject the Sculptra, we want to massage the face so that we're distributing the little particle evenly throughout the face. Although we do that with the injections, by doing some massage afterwards for a couple of minutes, several times a day for a few days, we can ensure a little bit better distribution of the little particle. It just allows for that particle then to be smoothly distributed so that the collagen reacts to it in a smooth fashion and we don't get a bump of collagen all in one spot. During the injection of Sculptra, the patient might feel a little bit of pressure, a little bit of discomfort. We do put some topical numbing medication on, and the product also has local anesthetic in it, so there's a little numbness to the face for about a half an hour after the injections. After that, for about 4 days, the face feels a little bit sore. The numbness totally goes away, and the patient can function normally. They can put makeup on and go out for dinner that evening. The biggest downside is perhaps a bruise in an area. You may or may not get bruising with a particular treatment. I always tell patients to expect some bruising, but they are often nicely surprised with Sculptra that they don't get visible bruising. Following the first several days after Sculptra, the patient feels no discomfort or anything as the collagen is being stimulated, so it feels perfectly natural. Sculptra is a biostimulator, which requires some time to see the result, but it does have a very long duration of effect because it is the patient's own collagen that creates the volume restoration. We have a new filler coming out, Juvederm Voluma, which has been available in Europe and Canada for several years. This has a lot of lifting power. It's a larger molecule of Juvederm, like Perlane, Restylane, Juvederm. These are all hyaluronic acids, which are carbohydrate gels that attract fluid to the area where they're placed and create a lift and plumping effect to the face. Juvederm Voluma we're looking forward to because we are able to use that product in the cheeks and temples and jawline. These are areas in which we typically use Sculptra to restore the frame and the convexities to the face. Having that lifting power and that increased duration of perhaps 2 years will really be an exciting development to what we can achieve in the face without having to wait for the result.